Before we dive in, if you love uncovering the hidden history behind everyday human experiences, hit subscribe so you don't miss what's next. Now, let's go back to the very beginning of human life itself. 1. Every single one of us was born. It's the one experience every human shares. But for most of human history, there were no hospitals, no epidurals, no sterile gloves, just a woman, her body, and the people around her. So how did our ancient ancestors actually bring new life into the world? The answer is stranger, braver, and more communal than you might think. Over the next 20 minutes, we're going to travel from the Stone Age caves of our earliest ancestors through Egypt, Mesopotamia, Greece, Rome, and beyond to see exactly how humanity has been delivering babies for hundreds of thousands of years. 2. Around 300,000 years ago, early Homo sapiens lived in small nomadic bands. There was no written knowledge, no formal training, just generations of lived experience passed down by word of mouth. When labor began, it wasn't hidden or clinical. It was often the whole group's business. Other women, usually older and experienced, would gather to help. This is actually a defining human trait. Unlike most mammals, human childbirth is difficult and often requires assistance. Anthropologists call this the obstetrical dilemma. Our narrow, upright walking hips combined with babies' large brains made birth genuinely risky, and support from others became essential for survival. 3. Ancient women almost never gave birth lying flat on their backs. That position actually came much later in history. Instead, they squatted, knelt, or stood, often supported by another woman standing behind them. This wasn't guesswork. Upright positions use gravity to help the baby descend and open the pelvis more effectively. Archaeological and anthropological evidence from cultures across every continent shows squatting as the dominant birth position for tens of thousands of years. Some women held onto ropes, tree branches, or the shoulders of a helper. It's a position so effective that modern midwifery has, in recent decades, started recommending it again. 4. Every ancient society had someone who filled the role of midwife, often an older woman who had given birth herself and had assisted many others. She wasn't a doctor in the modern sense, but she carried something just as valuable: pattern recognition. She'd seen dozens of births. She knew what normal labor looked like and what trouble looked like. She'd press on the mother's belly to feel the baby's position, offer words of encouragement, and know when to intervene. This oral, apprentice-based knowledge, passed from woman to woman, was humanity's very first medical specialty, long before the word medicine existed. 5. In many ancient and indigenous cultures, birth didn't happen in the main dwelling. It happened in a dedicated birthing hut set apart from the rest of the camp or village. This served two purposes. Practically, it kept the process private and controlled, away from the noise of daily life. Spiritually, many cultures viewed childbirth as a powerful, even dangerous threshold between life and death, requiring its own sacred space. In parts of Africa, the Pacific Islands, and among indigenous peoples of the Americas, these separate birthing spaces persisted for thousands of years, and versions of the tradition survive in some communities even today. 6. Ancient Egypt gives us some of the earliest physical evidence of birth practices. Women squatted on a pair of large mud bricks called birth bricks, which elevated them and gave the midwife room to work underneath. One surviving painted brick, discovered in the ancient city of Abydos, and dating back roughly 3,700 years, actually shows a mother holding her newborn flanked by protective goddesses. Egyptians believed the goddess Meskenet personally attended every birth, and the god Bes, a dwarf deity, was believed to ward off evil spirits during labor. Religion and medicine weren't separate categories back then. They worked side by side in the birthing room. 7. Egyptian midwives weren't just present for support, they were remarkably practical. Medical papyri, like the Ebers Papyrus, dated to around 1550 BCE, contain instructions for easing labor pain, encouraging contractions, and even primitive pregnancy tests using barley and wheat seeds soaked in urine. If the seeds sprouted, the woman was considered pregnant, and modern researchers have found this test correctly identified pregnancy hormones a surprising amount of the time. Midwives also use massage, specific herbs, and controlled breathing techniques. It's easy to imagine ancient birth as chaotic, but Egyptian records show something closer to a structured, generations-old protocol. 8. In Mesopotamia, modern-day Iraq, clay tablets dating back nearly 4,000 years describe birth incantations recited by midwives to ease difficult labor. These weren't just superstition. Many incantations were paired with real physical techniques like applying oil to ease delivery or repositioning the mother. The Babylonians associated childbirth with the goddess Ninmah, and difficult labor was sometimes explained as the influence of demons, leading midwives to combine ritual chanting with hands-on care. It's a pattern we'll see again and again. Ancient birth attendants were simultaneously healers and spiritual guides, because the two roles hadn't yet been separated. 9. By the 2nd century CE, Greek medicine had become remarkably systematic. A physician named Soranus of Ephesus wrote one of history's first detailed gynecological texts, describing an actual birthing chair, a wooden stool with a crescent-shaped opening that let the midwife access the baby, while the mother remained upright and supported. Soranus described 3 trained attendants, one to hold the mother, one to receive the baby, and the midwife herself directing the process. He gave detailed advice on cutting the umbilical cord, clearing the newborn's airway, and even recognizing breech positions. This wasn't folklore, it was structured clinical practice. Over 1,800 years ago, 10, Rome inherited much of Greek obstetric knowledge and refined the tools. Roman midwives, called obstetrices, the very root of our word obstetrics, used bronze instruments for difficult deliveries, including hooks for cases where the baby had already died and needed to be safely removed to save the mother's life. This is an uncomfortable but important truth. Ancient midwives sometimes had to make devastating choices with no modern alternatives available. Roman law even recognized midwifery as a respected profession, and some midwives, like the physician Metrodora, wrote their own medical texts. It shows just how advanced pre-modern obstetric care could genuinely be. 11. One universal moment across every ancient culture, cutting the umbilical cord. Without metal tools, people improvised brilliantly. Some used sharpened flint or obsidian blades. Others used a sharp reed, a shell, or even their own teeth in emergencies. In many cultures, the cord was tied off first with plant fiber or sinew before cutting. The length left on the baby, and even the tool used, often carried symbolic meaning in some Native American and African traditions. The cutting tool was chosen based on the hoped-for future of the child, like a hunter's tool for a boy or a weaving tool for a girl. 12. Across cultures separated by oceans, the placenta was rarely treated as medical waste, it was treated as meaningful. Many indigenous cultures buried it beneath a newly planted tree, symbolically linking the child's life to the land. In parts of Southeast Asia, it was sometimes buried near the family home for protection. In ancient Hawaii, burying the placenta was believed to tie the child permanently to their birthplace. These weren't random customs, they reflect a shared cross-cultural instinct. Birth wasn't just a biological event, it was a spiritual entry into community, land, and family lineage, and the placenta symbolized that connection. 13. Pain relief in ancient birth wasn't as absent as people assume. Egyptian and Greek texts mention opium poppy for severe pain. Willow bark, the natural source of what we now call aspirin, was used for inflammation and discomfort. Raspberry leaf tea was used across multiple cultures, including by Native American and European midwives, to help tone the uterus before labor. Massage, warm compresses, and controlled breathing were near universal techniques. It wasn't modern anesthesia, but it wasn't nothing either ancient midwives had built. Through trial and error, across thousands of years, a genuine pharmacological toolkit long before pharmacies existed. 14. Practices varied enormously across the hundreds of distinct Native American nations, but many shared common threads: upright birth positions, dedicated birthing lodges separate from daily life, and experienced female relatives or community midwives guiding the process. Some Inatians used specific plants, like black cohosh, to help stimulate labor, a plant still studied today for similar effects. Physical support was often literal. Women held ropes hung from lodge poles or braced against a helper's shoulders while squatting. Newborns were often washed in cold water shortly after birth in some traditions, believed to strengthen the child, a practice reflecting deep culture-specific beliefs about resilience and survival. 15. Across the many diverse cultures of the African continent, childbirth was often deeply communal, involving multiple generations of women. In many communities, singing and rhythmic clapping accompanied labor, not just for comfort, but because rhythm and breath are genuinely connected, and vocalizing can help manage pain. Traditional birth attendants, sometimes called TBAs, held immense respect and authority. They diagnosed complications, turned malpositioned babies through external manipulation, and passed the enology down through direct apprenticeship, often over decades. In fact, traditional birth attendants remain active in many African communities today, working alongside modern healthcare systems rather than being replaced by them. 16. In ancient China, birth was understood through the lens of balance, particularly the concept of restoring yang, or warmth, after the perceived cooling and blood loss of labor. This gave rise to Zuo Yuezi, or sitting the month, a month-long postpartum recovery period still practiced today, involving warm foods, rest, and avoiding cold water or wind. During labor itself, midwives used acupressure on specific points to ease pain and encourage progress, alongside herbal remedies documented in texts over 2,000 years old. It's a powerful example of how ancient medical systems built entire philosophies not just around the birth itself, but around a mother's recovery afterward. 17. Ancient India's Ayurvedic medical tradition, with texts dating back over 2,000 years, treated pregnancy as a 9-month process, requiring careful monthly guidance on diet, oil massage, and herbal support. Sesame oil massage was used to keep the mother's body flexible for labor. Midwives, often called dais, were trusted specialists who guided delivery, and specific herbs like fenugreek and ginger were used to support recovery and milk production afterward. Ayurvedic texts even describe different fetal positions and appropriate interventions for each, showing a level of anatomical observation that, in some ways, wasn't formally matched in European medicine until many centuries later. 18. It would be dishonest to romanticize ancient childbirth completely. Without antibiotics, blood transfusions, or emergency surgery, both maternal and infant mortality were significantly higher than today. Historians estimate that in many ancient and pre-modern societies, it's likely that a notable percentage of women died from complications over the course of their reproductive years. Infections, obstructed labor, and hemorrhage were the leading dangers, and midwives, however skilled, often had no way to address them. This is part of why childbirth carried such spiritual weight in so many cultures. It truly was one of the most dangerous moments in a person's life, for both mother and child. 19. In most ancient cultures, birth was considered exclusively women's space. Men were frequently barred from the birthing room entirely, sometimes for religious reasons, sometimes purely practical ones. This wasn't necessarily about exclusion. Many cultures viewed the birthing room as sacred, powerful, even dangerous in a spiritual sense, requiring specific knowledge and rituals that only experienced women held. Ironically, this is part of why male-dominated medicine took so long to formally document birth practices. The knowledge itself lived almost entirely within oral, women-led traditions, deliberately kept outside written, male-controlled record-keeping for thousands of years. 20. Here's the remarkable part. Modern midwifery, doulas, upright birthing positions, and even water births are, in many ways, a return to ancient wisdom, not a departure from it. For most of the 20th century, hospitals pushed women into flat, reclined positions for the convenience of doctors, a historical anomaly, not the ancient norm. Today, research increasingly supports what ancient midwives already knew instinctively. Movement helps labor, continuous support improves outcomes, and upright positions work with the body, rather than against it. From flint blades to modern scalpels, from birthing bricks to hospital beds, the tools changed dramatically, but the core human instinct never did. Surround a mother with people who know what they're doing and trust the body to do what it has done for hundreds of thousands of years. That's how ancient humans delivered babies, and in more ways than we often realize, it's still how we do it today.